Tell us, about the need to even start writing it in the first place. Well,
Well, I do a lot of posts for my friends. People have a lot of questions about things related to COVID. So for the past 2 months, I've been doing a lot of different posts on just all sorts of topics related to this disease and making myself available to people to ask questions.
and do you have any children yourself who will be attending in the fall?
I do not.
But you know a lot of people, and obviously it's circulating the rounds on Facebook.
Oh, right, right.
So tell us about the post. What did you find in that post? You had a couple of different bullet points. I don't know where we want to begin.
Well, I think one of the important things to remember is that we need to look at the science behind this and not just the raw emotion. I understand that parents are very concerned about sending their kids back to school. And the question is it safe? So that's really the first thing we have to look at. Is it even safe to do this in the first place? If you look at the scientific evidence out there, schools are not driving this outbreak. Kids are at a lower risk of being infected. If they do get infected, they have less risk of getting disease, and they're less likely to spread it to their family members. So from that perspective, there is some safety there. It's not the doomsday scenario that a lot of parents want to paint when it comes to sending their kids back to school.
So how can districts do this safely?
Well, there is no one simple thing that we can do. It's really a combination of approaches. You have to look at the littlest kids and high school kids differently as well, because high school kids are more likely to spread it and more likely to have serious disease compared to the littlest kids. And so we have to think about the stuff that we've been talking about for the past few months, which is really social distancing and wearing masks. There's some component of cleaning the facilities as well, but really it's about keeping kids apart, and if they are close together, having them wear masks so that there isn't disease spread among them. Even though they're at lower risk for disease, that doesn't mean there's no risk of disease. So we still have to take all those steps just to protect everybody from transmission within a classroom setting.
So staying on this topic, specifically on grade levels, are there certain grade levels that are at higher risk than others?
Well, the older the kids, the more like adults their biology is, which puts them more at risk of disease. So you're really talking around puberty, but that's not an easy thing to break your grades into. So you can treat elementary school one way, you can treat high school kids differently, like you would adults. And then middle school, you have to make a decision about how you're going to group them together. It could really kind of go into either camp there. So there is this difference you see from the youngest to the oldest.
Mhm. So what other findings did you talk about in that post?
Well, there were a lot of different things. It was just a number of different issues related to the infectious disease. I was really looking at what we've seen around the world. So what sort of outbreaks they've seen in other countries when they started going back to school. And if you look at what's happened worldwide, schools have not been driving the outbreaks in their community. Of course, there can always be some transmission within schools, but if you look at a lot of the experience of countries in Europe, they didn't really see much transmission in the classrooms. And when things did happen, it was the adults spreading it to other adults and not necessarily the kids to other kids or the kids to adults.
So knowing this data, how should school districts move forward?
Well, I think they need to take all these things into account. This is just one aspect of returning to school. There are all sorts of other things that you have to consider, not just the public health pieces. If you're going to have online learning, do the kids in that school district have access to the internet? That's a huge problem, especially in the lowest income families. If the kids have to stay home, what happens to the parents then who need to go to work? So all those things wind up being part of the overall decision. But if you look at the public health piece, I think the reality of the risk is different than the way people are presenting it, as if it's kind of the end of the world if we reopen schools. And that's just not the case.
And did you reach any conclusion or conclusions in plural?
Well, it wasn't really conclusions. It was a lot of just, it was basically presenting all the data that's out there and trying to say, here are things that places have to keep in mind. I touched on things for teachers as well, looking at a lot of teachers groups want universal testing of all the teachers, and there's no evidence that that actually works. And with the testing system being overwhelmed as it is right now, it could completely grind things to a halt. We're seeing delays of up to a week in getting the test results back. So if you get the test and have to wait a week for the result, by the time you have it, it really hasn't kept anybody out of school. Plus, they've had a chance to be infected going about their normal lives in the community anyway. So that's one thing that we've seen around the country. Different universities and schools and teachers groups have insisted on that sort of thing, but there really isn't the evidence that that's going to help anyone.
Do you think though that if they do have widespread testing for those teachers or for students, do you think though that it might help separating those kids or teachers who may be infected?
Well, there's a few problems with that. First of all, half the people who were infected don't have any symptoms, so that's what we're trying to look at with the testing. But there's a delay of up to a week or more of getting results back right now. So that's really not doing anything to keep those kids out of school. So say you tested every kid right before they started school, you wouldn't have the results for a week after that. And for us to test every kid or every teacher in Southern Nevada would completely bring the testing system to a halt. If you look at recommendations from the CDC and other groups, nobody is recommending universal testing in schools or in any other businesses. We've seen it in the community. We've seen places put it in for their employees where they want to say, we've tested everybody before they came back and now it's safe. But it's more, unfortunately, the illusion of safety than actually doing anything to protect people against spread of this disease.
What's the feedback you've received from both parents and teachers about this?
Um, well, it's people I know for the most part that are responding to me. I've gotten a lot of questions on different things. I think people are just appreciative of getting some more information about it. Of course, there's always some people who are going to disagree with anything that you say, but for the most part, people have just been appreciative that I'm willing to share these things and answer their questions. And for some of them, it's really set their mind at ease and trying to make decisions about sending their kids back to school.
And what's pretty unique about this post is you see a lot of rants on Facebook, but this isn't your ordinary one. It actually has a list of resources.
Yeah, I put references in this one. I do a lot of different posts, and I've had other people complain that on a previous post that, oh, there was no reference for that, he just made it up. So I put all the references in this time. So if people wanted to look at a specific study that I was referring to, or something like the American Academy of Pediatrics plan, which is similar to the things that I was saying, there's a link to that so they can go follow those things on their own and don't have to just believe some guy on Facebook.
Mhm. And as a professor over at UNLV, and this is part of your expertise, why is it important for you to write something like this for those parents who are really just uneasy right now?
Well, part of it was just for people I know who've asked me a lot of questions about this. So it's just making my life easier because I keep getting messages from everybody and questions from everybody. Should I send my kid back to school? Part of it was trying to understand the situation better for myself and really looking at the evidence. But I like being able to do this for the community. It's something that I have expertise in, and I think it's probably better if you have somebody who understands these things putting their 2 cents in versus somebody who's just really angry and upset and scared and ranting about it without any real scientific backing. So we've heard from people who are very upset about having to send their kids back to school. They're afraid of what could happen, and this is really a less passionate view of that. I'm not doing this about sending my kids back to school. It's here's the scientific evidence of what we're talking about related to returning to school.
And it's been that post, it's been shared, I think, close to 800 times. Do you know how many times it's actually been
Yeah,
viewed?
it's something like that right now, around 800.
Do you know how many times it's been viewed?
No, those numbers aren't on there. I'm sure it's been seen a lot more than that. It'd be really interesting to see those sort of things. I'm just glad that the information is getting out there and it's sparking debate, if nothing else. It's not a list of here's what the school district should do or what every parent should do. It's really things to think about when we're making these decisions. I'm not trying to make the decision for anyone. I'm trying to give them the information they need to make a better informed decision.
And it's pretty timely because on Tuesday, tomorrow night, the school district's getting together again to discuss those reopening plans. Any suggestions or word of advice for the people making those decisions on the board?
Well, I think it's an incredibly difficult decision. Whatever they decide, half the parents are going to be really upset. I don't think there is a correct answer in this. People are just going to be very upset with whatever is suggested because it makes their lives more difficult. There isn't a one-size-fits-all approach. But my suggestion would be look at the scientific data and use that in making your decisions. But also that can't be the only driver of the decisions. The practical concerns are there as well. If we decide we need to send everybody home and do remote learning for everyone, we have to have a plan in place to make that actually work. So this is just really kind of hopefully bolstering some of the scientific information and allowing them to make better informed decisions.
Mhm. And lastly, in the post, you kind of went through a couple of steps. Like, for example, you mentioned, the first thing school districts need to look at is, COVID-19 in kids. Can you sort of give us like a short summary of what your post talked about from, start to finish?
Well, the first thing I talked about was just looking at the severity of the disease, and I looked at the numbers from New York City. The disease we see in kids is different than we see in adults. Kids are less likely to get it. If they do get it, they're way less likely to be hospitalized, and deaths are rare. Now, that's not to say those things don't occur, but we're talking about a disease that presents differently in kids than adults, and I think that's something we need to keep in mind. You can't use your experience in reopening a business in trying to decide what to do with the school. And then the other thing I looked at, the scientific information on transmission within kids. We're not seeing a lot of transmission from kid to kid within those classrooms, looking at outbreaks that have happened in other parts of the world, or where a sick kid came to school and you didn't see transmission in the classrooms. It starts to give us an idea of the risk of spread in these types of settings. After that, I talked about a lot of different things. The importance of social distancing and wearing masks when they return to school, and the absolute importance of not sending your kid to school if they are sick. If we're concerned about disease transmission in a classroom, the worst thing you could do would be to send a sick person into a classroom to allow that sort of thing to even occur. So there's a lot of different things that I touched on in there on the disease and some of the risk mitigation steps. And I think it all comes down to that. The idea that we can never completely eliminate the risk. And that's unfortunately what some parents want. They want a perfectly safe environment, but that's not true for any time we have a classroom setting. Kids can always do things that result in them getting injured or sick. And so that's really kind of the big focus there is let's not have high risk, but we also have to be reasonable and say we can't have a zero risk environment. That's just not reasonable.
So what, in this case, what would sort of reign supreme here? I think you wrote, said something about social distancing would be.
So if you look at the plans that we've seen from like the American Academy of Pediatrics or other groups, it always talks about the importance of social distancing, keeping kids apart as much as possible. We want that 6-foot distance in the high school kids. And younger kids, you can actually shrink that distance a bit. And their recommendation is you could actually go as low as 3 feet if there is appropriate social distancing there, which means masks and other steps to keep the kids apart. Now, I know that's a huge challenge with elementary school kids who aren't going to listen to anything that you say, but that's got to be part of the discussion. Is there a way we can do these things to keep people separate to stop that transmission of disease? And if we can do those sort of things, that could really affect the number of kids that we can put in a classroom, for example. If we can go shorter than 6 feet, you could put more children in a classroom without really increasing the risk potentially if you can maintain the social distancing.
We talked about elementary schools, middle and high schools. Did you look at universities or college campuses about the impact there?
College campuses are a completely different story because you're not talking about the same type of risk environment. You have students coming together for shorter periods of time. You're not spending all day long with that many students in the same classroom. So it's a very different environment. My post touched on basically elementary through high school education because that's what really the concern is. When you get to older kids, when you get to college age students, it's a very different scenario, and there are different things that we can do to try and protect them that wouldn't work in an elementary school and vice versa.
Anything else you'd like to add?
I always like it when people appreciate the work that I do on something like that. It's nice to be able to contribute to the overall discussion. And if it helps some people out, great. I love to be able to share that sort of information with them to help inform their decisions.
Gotcha. Cool. Anything else you want to make sure we mention?
No, I think we're good.
All right. So the story is going to air tomorrow morning
Okay.
at 5 and 6 a.m. in case you want to watch it, but we'll also have a link on our website.
Okay, sounds good.
Awesome. I appreciate your help. Thank you so much.
All right, take care. Bye.
You too. Bye.